Ladies and gentlemen, we now move into our fourth plenary session for the 2024 summit entitled Transforming Higher Education for Planetary Health. It now gives me great pleasure to invite our distinguished panelists up to the stage. Please join me in welcoming Professor Dr. Raja Affendi Raja Ali, Dean, School of Medicine and Life Sciences at Sunway University. Dr. Courtney Howard, Clinical Associate Professor at the University of Calgary. Dr. Jelena Malogajski, Education Director of the Planetary Health Alliance. Young Bahagia Dato Seri Engineer Dr. Zaini Ujang, the Secretary General, Higher Education Ministry, Malaysia. This session will be moderated by Professor Dr. Donald T. Simeon. He is the Director of the Caribbean Center for Health Systems Research and Development and Professor of Biostatistics and Public Health at the Faculty of Medical Sciences at the University of the West Indies, Trinidad and Tobago. He is a chartered statistician, fellow and council member of the Royal Statistical Society in UK, as well as a registered public health nutritionist. He is also chair of the Caribbean Regional Hub of the Planetary Health Alliance and a member of various research ethics committees. His professional interests include public health, planetary health, research and data ethics, biostatistics, nutrition, and health policy and systems research. Please join me in welcoming Professor Simeon and this distinguished panel.
Thank you very much and good morning to everyone. During the next 50 minutes or so, we'll be discussing how we can advance planetary health goals through higher education. At this pivotal moment, we must reassess and perhaps restructure traditional teaching methods to ensure the integration of planetary health into education systems so that we can cultivate a generation mindful of humanity's impact on the planet. While acknowledging the merits of existing educational methods, it is equally important to recognize their limitations. The growing need to underscore the interplay between human actions and planetary well-being calls for systemic change. Also, what is the role of academia in producing more timely research and of course, disseminating the findings to a broader audience. So I'd like to introduce the panelists this morning. I'll first start with Dr. Jelena Malogajski, who is Education Manager with the Planetary Health Alliance. Welcome, Jelena. And next, Professor Raja Affendi Raja Ali, Dean and Professor of Medicine and Consultant Gastroenterologist at the School of Medical and Life Sciences, Sunway University. Then I have Dr. Courtney Howard, who is Emergency Physician, Associate Professor at the University of Calgary, and Vice Chair of the Global Climate and Health Alliance. And of course, last but not least, Dr. Zaini Ujang, who is a professional and chartered environmental engineer, and notably the Secretary General, the Ministry of Higher Education here in Malaysia. So I would like to welcome all, as you would have noted. I did not have any extensive bios to read, so I'll be asking the panelists to say a bit of the work that they do, especially related to tertiary education and planetary health. Also, there'll be no slides. We are taking a different approach, just having a discussion among the panelists. I also note that we had received an email this morning with feedback from the delegates saying that they want to be more involved and the importance of having a Q&A session. So we'll also try to incorporate that because it's really a discussion among all of us. Of course, my role is to just moderate the discussion and to ensure that, that the panelists and the audience, are able to really share their views on this critical issue of of tertiary education and planetary health. So initially, each speaker will have 5 minutes to see a bit of the work that they are doing, especially related to tertiary education and planetary health. And I'll first invite Dr. Jelena to provide an overview of planetary health education based on her work at the Planetary Health Alliance and as co-lead of the education subgroup for the preparation of the roadmap. Jelena?
Good morning, everyone, and thank you for inviting me to be a part of this very important conversation about planetary health education. My name is Jelena Malogajski. I am the Education Director with the Planetary Health Alliance, and in my work, I focus on all things planetary health education related. Through the Planetary Health Expand initiative, we, and by we I mean the education team at the Planetary Health Alliance, contribute to the growing momentum of incorporating planetary health into public health, nursing, and medical curricula. This initiative strives to ensure that clinicians and students of health professions expand their understanding of the Earth crisis and all the ways that the Earth crisis is influencing not only all the aspects of the human health, but also all life on Earth. However, recently, over the last 6 months, I've had a great pleasure and an incredible honor to co-lead the education working group working on the education section of the roadmap. And as an education working group, we have concluded that we need to widen the scope. We have concluded that we need to understand planetary health as foundational knowledge across disciplines. So in other words, it is not enough to focus only on students of nursing, medicine, and public health. We need to recognize that students of business, law, philosophy, art, theology, agriculture need to become a part of this conversation. As a part of an integral part of the Expand initiative, is landscape analysis of the planetary health education globally. And we do that in order to understand the states of the planetary health education globally, to understand where the gaps are, to identify the success stories, and then to share these lessons learned with our wider community. And I would just like to kind of share with you today a few of the key takeaways that we got from these interactions with amazing, successful planetary health educators globally. So one thing that we asked them is to talk about facilitators and barriers they experience in introducing planetary health education efforts. And one of the often mentioned barriers is limited space in the curriculum. And I'm sure that nobody is surprised to hear that. But also what we hear from the educators, that the way they find to kind of go around this roadblock, if you will, is to integrate planetary health across the curriculum, to weave it in the existing courses rather than adding an additional course. Another barrier often mentioned is faculty reluctance to teach planetary health courses since they find themselves not educated enough on that. And this is something that we in the Planetary Health Alliance are really trying to support them with creation of new planetary health education resources, but also curation of the resources created by our partners and collaborators. And additionally, I would just like to say a few words about and I left that for the end, about facilitators and successes. What we learned from the planetary health educators is that teaching planetary health advances their research agendas. In its nature, planetary health is transdisciplinary. So when you are part of the group of people teaching that, you connect with other researchers and you create new and interesting research together. So this is one thing that we heard time and time again as a very positive outcome of teaching planetary health. And additionally, very important one is also student demand. And this is globally, the truth that students are the driving force behind advancing planetary health education globally, and we should be listening more carefully to the students. And finally, one message that I would like to wrap up my opening today is an advice that we received from the educators we talked to. They always tell us, be aware of the time. Be aware of the calendar. When is the next curriculum revision? When is the next accreditation revision? Be aware and take advantage of those windows of opportunity. Thank you.
Thank you very much, Jelena, for those opening remarks. I am also a member of the education subgroup, and I would like to thank you for your excellent leadership. Excellent. Next, I will invite Dr. Courtney to say a bit of the work that you are doing, and of course, following on from Jelena, some of the opportunities, challenges that perhaps you encounter in the area of tertiary education and planetary health.
Sure, thanks. So it was 2009 when I read the Lancet Commission's statement that climate change is the biggest global health threat of the 21st century, and I happened to read it in a hospital that's one of the world's most northerly teaching hospitals in Inuvik, where it's already 3 degrees Celsius warmer than it was when an 80-year-old elder was born. The hospital actually sits on permafrost. And so I had just finished training in emergency medicine, and I'd given my 20s to learning emergency medicine, and there I was learning that somehow I hadn't learned anything about the biggest health emergency of all, and I was angry. So I went straight down to a family medicine meeting and asked everybody why we hadn't learned about it, but the problem then, as it is now, was that the senior leaders didn't know what they didn't know about the topic. And since then, I have tried all sorts of things to get this into curricula. I was involved in the creation of the first Planetary Health report card. Medical students in Canada drove that, as you know, and that has moved internationally. I have showed up to all sorts of curriculum meetings, caused trouble at annual general meetings of medical associations, et cetera. And so I want to talk a little bit about the advocacy tactics that have actually worked to get it into curricula. So what I have often found is that coming and asking for something doesn't often yield many results. But what finally worked in Canada was that we had a highly placed dean who is leading the Association of Faculties of Medicine of Canada, who decided to create a declaration on planetary health. And so she convened a multidisciplinary group from around the world. I helped make it. And it's a series of commitments. And then we structured it so that there was a time-limited yes or no sign-on leading up to the International Conference on Academic Medicine. And she got a couple of her highly placed friends to commit publicly. And so what we saw was a race to the top in terms of peer pressure, so that by the time that timeline ended, we had 16 out of 17 medical schools signed on. And so just acknowledging that there's 2 steps. There's the advocacy required to get it into curricula, and then there's the development of the curricula itself. So this last year, I've spent about the last 2.5 months doing a contract for Health Canada with regards to the implementation of the declaration. And so did a landscape analysis, gap analysis, and still the senior leaders not knowing what they don't know is the major gap. And what we have decided is that we too will build a national planetary health resource center to help support people who are just coming into this, and also acknowledging that there are many different structures that so far need building. We're going to really lean into teaching medical students advocacy skills so they can be involved in making sure that this continues to go into curricula. And as one of our KPIs, we're going to have every school redo the Planetary Health report card, aiming for an improvement year on year, and every single year asking the Planetary Health faculty lead at that school, the medical student in charge, and the dean to sit down together at a meeting to review progress, to help make sure that the medical students who are driving it have access to the powerful people who are really the people in charge of implementation. So since I started doing this with medicine, we've now done a curriculum survey of engineering curricula in Canada. And my friend Will Gagnon asked me the other day, do you think we need to do the Planetary Health report card for engineering schools? And I said, yes, I think we should just run the same game plan. And last year, as it turned out, I was economics student in public policy at Oxford, and I knew Kate Rayworth. And Kate Rayworth, who's a rock star economist, as you know, who will be speaking at this conference, is herself having such difficulty getting this into the economics curriculum at Oxford that she ran an 8-part after-school opt-in series of donut economics that you could sign up for if you were taking any economics classes at Harvard. So I helped to run this as a master's student, and coming out of that, we issued an open letter calling on the University of Oxford to change its curriculum in service of planetary health. So just really acknowledging for all of you who are still struggling, who haven't yet managed to find a country like Malaysia that's so far forward that it's actually putting a national planetary health plan together, who haven't yet managed to be in a position where the people in charge actually come to the meetings, who don't have a dean who's learning how to do it. And you don't have champions like Jamila who have done so much work to get it there, that work of getting it in that pathway, there's tactics that have been used in other places that can be rerun in your place, and we're super happy to help you. So looking forward to hearing from the dean here.
Thank you very much, Dr. Courtney, and I will hand over now to Professor Affendi to give his views in terms of the work being done here in Malaysia, here at Sunway University. Of course, you are the Dean of the Faculty of Medical and Life Sciences.
Assalamualaikum warahmatullahi wabarakatuh. Peace be upon all of you and good morning. Thank you, Professor Simeon, for the question. And firstly, I would like to thank Tan Sri Jamila and the team for the kind invitation, and Sunway University for holding, I suppose, a bigger success. Congratulations for the PHM 2024. When I got the email of invitation to be a panelist, I was scratching my head, as the planetary health is very unusual, new concept for me, and I wrote a little piece of statement I want to repeat here. I think we need to resuscitate medical and higher education system by administering public health medicine as Earth getting sicker and sicker. That's my opening statement. And I think the concept of planetary health is very new to me and my colleagues in medical fraternity, and I can foresee a lot of challenges and barriers that we will see for the next coming years. First of all of us have very established traditional way of medical curriculum, from the foundation, preclinical, biomedical basic sciences, clinical, residency program, fellows, and after 9 to 10 years, you or he or she will become a specialist in whatever field. In my area, digestive system, for example. And a lot of basic science and clinical sciences involved, and I'm struggling where we're going to embed the planetary health in medicine in the established medical curriculum. I was expecting a lot of changes, a lot of resistance from whoever you are in terms of how we transform this higher education, focusing on medical education, embedding planetary health system. And I think this requires transformation. And what it means, I'm going to make people upset to the level that they can tolerate, where the planetary health can be embedded into the existing medical higher curriculum. I give, for example, interprofessional education, or IPL, interprofessional learning, is there. So how we put in planetary health inside there with nursing colleagues, pharmacy colleagues, engineering colleagues, social scientists together to come out with some problem-based learning. For your information, after hearing the talk by Dr. Nicole Redworth yesterday, I was scratching my head to create the problem-based learning for medical students. We all used to have the problem-based learning. 50 years old man presented with chest discomfort, come out with all the symptoms and what are the investigation you want to do and how you treat and what's the diagnosis. Discharge, treatment, off you go. So how I'm going to translate into the planetary health? So I give you this scenario, and I'm challenging my colleagues out there whether you are a surgeon or physician or whatever specialties. For example, I am a tree. I am 40 years old tree. My body is shivering because of the temperature is rising. My leaf is keep falling. The flooding affecting my body twice a year. The factories next to me keep polluting and I cannot breathe. And can you help me do some investigation, come up with diagnosis and treat me accordingly? I said, wow, I don't know how to solve this. So this is a barrier challenges. And the good thing, things are dynamic. I think we have to re-educate ourselves. And one of the powerful way is collaboration with multi-sectors, Ministry of Higher Education, or the interministerial crosstalk. We need to sit more on the table to do crosstalk. And then one of the essential, I think, 3 elements of productive collaboration in education. Number 1 is building the trust among all of us. And then cultivate the share or common purposes. And then subsequently have a high energy and leading to the productive collaboration. And the faculty expertise also, Professor Simeon, is very minimal. Who's going to be the content expert in delivering medical higher education? So we need you guys, the expert, sit down, social scientists, to give us the answers, how to treat, how to manage the tree that has been complaining to me just now. You know, and we neglect so much to take the earth as a stakeholder in whatever we do in clinical practice. I'm a gastroenterologist using endoscopies for many years, and believe or not, one of the ways to reduce the complication of bowel perforation is using CO2 system of endoscopy. And I'm guilty of polluting the earth with CO2. Now, I stopped reducing this for the last 2 years without any complication. I think we can do this together, and there need a lot of re-education. We need a lot of understanding. We need to put this planetary health in the sequence that we are not upsetting all the stakeholders to the way that they can tolerate, and we have to learn. We have to change over the time. If we don't change, we will be changed in the future. I think that's all for me as an introduction, Professor Simeon. Thank you.
Thank you very much, Professor Affendi, and I'm really pleased that Dr. Zaini is with us this morning. I tend to be at meetings such as this and speak a lot with my academic colleagues. So I'm really glad that we have someone from government, a policy maker, who can let us know, what it really takes to make total transformation that is needed to really address the issue of planetary health at the tertiary education level.
Thank you for inviting me. It's very interesting you asked me to introduce myself. I'm a very confused person. I was a professor and I was Vice Chancellor or President of university. I left about 11 years ago. I joined the government. The first job was this job, Secretary General, Ministry of Higher Education, and then I went to Ministry in charge of Energy, Green Technology, Water, finally Health. 2 months ago, I was still in Ministry of Health. And when Tan Sri Jamila came to discuss with me about planetary health, I was in charge of climate change at that time, about 3 years ago. What was presented by the Professor Gupta just now was my staff on daily basis, and I was the head negotiator for Malaysia climate change. Attended climate change events representing Malaysia for the past 10 years or so. So it's very interesting. I was trained as chemical engineer. I then became environmental engineer. But the interesting point, when I did my master's in England, the subject then at master's level called public health engineering in the 80s. So we learn about public health, some kind of diseases, airborne diseases, waterborne diseases, and whatnot. So I'm a bit familiar. And about 30% of my classmates were medical doctors at that time. After 1990, when United Nations started talking about climate change and sustainable development, the subject of public health engineering was no longer sexy then. The same course change became environmental engineering. And subsequently, I think for the past 20 years, it became environmental engineering. And in the year 2020, the water group at the university where Tan Sri Jamila and I met for the first time in Newcastle upon Tyne, it's a Geordie land, organized a conference for 70 years water at Newcastle University. Newcastle is very famous for a person like John Snow. I mean, he was trained in Newcastle. Therefore, the tradition on water research is very strong in Newcastle. And I was invited to give a plenary or keynote address. Two speakers, one from Oxford University, and I was the second person. And we were discussing about the future of water framework or water governance. And as I mentioned earlier, it started since 1951 or 41, I forgot. It was called Masters in Public Health Engineering, PhD in Public Health Engineering. It became Environmental Engineering in 1990 because to address the issue of climate change and whatnot, and now became sustainability. So it's no longer water. They don't want to attach water to it because when you talk about sustainability, it should be also encompassing the whole thing. The earth system, the water ecosystem. So we have hydrosphere, atmosphere, lithosphere, and whatnot. There are 4 or 5 things that you can put together. So that's the history of my career. And I'm very glad because I'm able to follow through the progress. And now we are integrated with medical practitioners here. Thank you.
Thank you very much, Dr. Zaini. Of course, I am really pleased to note of your academic background and, of course, your appreciation for all that we are discussing here. But from your time as a government official, as a policymaker, what do you think is needed to really make that transformation? To really get planetary health on the agenda and, of course, accepted in tertiary level programs?
Okay, it's very, very important question. The conference that we had in Newcastle, January 2020, a few weeks before COVID became prominent, we were discussing about the framework, where with this framework, you can integrate medical education, engineering education together, and the rest. So that's what they are focusing on. Therefore, people from lower background can talk about planetary health, can talk about climate change and whatnot. In the past, it was almost prohibitive to you to enter other domains. If I were to talk about health, people say you are not health expert, you are professional engineer, you should talk about engineer. So we enter others' territory. But I would like to give you example of the framework. So I should confess, when I come here, I made very big sin. I shouldn't talk about climate change here because this morning I traveled 30 kilometers from my house using my car, chauffeur-driven, alone, distance 30 kilometers, petrol emission and total emission was 5.35 kilograms CO2. And times 2, it will be 10.7. So I should plant a tree when I travel back and forth 4 times. So if you have that in mind, and then we are talking the same level. Similar to Professor Raja, you mentioned about I shouldn't use CO2 anymore. So this is the conversation should be. And this is the framework. Whatever you do, you calculate your CO2 emission of, GHG is more appropriate. You can have a separate discussion on that, but I think GHG is more convenient and more illustrative in terms of the whole climate change framework. And then we have what we call from transformation to action. So we are no longer talking about theoretical aspect, which I think is well developed at the moment. What is needed is an action to be in place. And say, for example, what should we do after we attend this conference, say, for example? On top of we make some changes in whatever we do, we should pay our carbon emissions. So how you pay your carbon emissions? There are many ways to do it. You just plant trees. What kind of trees? This is very academic. Well, there's a system for it. But at the same time, as a planner like me, we have to think how best people can travel with less CO2 emissions going to be. This is what we should invite other professionals to talk about planetary health as well. Thank you.
Thank you very much, Dr. Zaini. I note your offer to plant a tree, and I just know that I myself may have to plant a forest, because I came from Trinidad and Tobago to here, and that took me about 2 days. So yes, I would like to open the panelists to your feedback on an issue. What has come through the initial discussion is that there is a need for systemic change. I would like to know what specific changes you believe we need to make, and of course, what are the challenges, what are the opportunities, that you will face. So this is an open question to the panelists. I'm not sure who would like to go first. Courtney? Okay, please.
Sure, thanks. I think that there are preconditions for systemic change. And the first one, and I see Britt Ray in the front there, is for us who love evidence as we go about all of this, to understand that every time we speak about climate change with other people or biodiversity loss, we're often bringing up emotions within them. So when I first started going to the Canadian Medical Association General Counsel and asking them to, for instance, divest from fossil fuels, people didn't want to talk to me. I had a lot of people duck into the bathroom when they saw me coming. And I didn't understand why entirely, because at the time I was a junior doctor and I was thinking, well, we're an evidence-based profession. My motion has an appendix all full of references for why this works. And I felt like they were being inconsistent with the way our profession was supposed to work. And finally, I realized that because climate change, ecological change is a diagnosis that affects all of us, everyone we love, and every patient we will ever treat, when I was bringing these ideas forward, I was leading them to consider them, and that was bringing up feelings of grief, of anger, of anxiety, of guilt, etc. And so I would invite you to just surface those emotions when you're having those conversations, because I found that I've been much more effective since I now get about, my ratios are usually 30% problem, 10% talking about the emotions that are involved in grappling with this, and then 60% action. And so the second precondition for systemic change, I believe, is action. So I've done academic work on change making, and we tend to, those of us who love science, have an information deficit model of change making where we kind of have an assumption that if we tell people things, they'll change their behavior. And as a physician, that generally doesn't work at the bedside either. You know, there's reasons why we have motivational counseling with different steps for tobacco cessation, and there's a whole way of doing it. It's because people have trouble just incorporating broadcast information and changing their behavior. So I would really invite you all to adopt a target-based model of change making where you strategically with your team figure out the most ambitious possible change that you can make with the resources available to you, whether that's social capital, political capital, or financial capital. Try to get that thing done, and sometimes you're gonna lose. So I lost the vote to divest from fossil fuels at the Canadian Medical Association it was at least twice before it finally passed. And it felt hard when we lost. But every single time, as it turned out, I was building relationships. People were starting to trust me more. They were understanding the information better. So when it finally passed, the whole room burst into applause. And I'm now a Canadian Medical Association board member, and it's one of the things we're very, very proud of. And so really when you're thinking about systemic change, starting one step back and thinking about how we can systemically change the way we go about making change. And so number one, really surfacing those emotions that come up, and number two, adopting a target-based model of change making.
Talking about systemic change, I would like to go back to the concept of transdisciplinarity, which is at the core of planetary health. And I think it's important first step to embrace it really, not just as in our professional pursuit, but to embrace transdisciplinarity in our personal lives and the way of being and connecting with others. And the other thing, again, starting at the personal level, and the reason I'm talking about the personal level, and Professor Simeon will know this, but while working on the roadmap, we were in the subgroup looking at what needs to change at the personal level. And I joined that group because I was the least maybe familiar with that. We talk about the community level, we talk about the professional level, policy and political, but we really wanted to explore the personal. And I would like to go back to the personal and talk about the values as well. The values that I believe we all share, we who are part of the Planetary Health community, and those are the values of inclusiveness, diversity, humility, partnerships, and justice. And to bring those values, which are personal to us, to our professional setting, as well as this pursuit of transdisciplinarity from the professional setting to the way of being and living. Thank you.
Thank you very much, Jelena. Yes, Professor Affendi.
Thank you. I think systemic change requires a growth mindset, in my opinion. Change is the only constant. And in order for us to have a growth mindset, we must be out from our comfort zone. We're really comfortable with what we are doing. We don't like people to disturb us. We control everything. Any new thing that appear to be changed in our day of living, we will be disturbed. So I think we really have to go to the fear zone again from the comfort zone, which is a learning new thing, which is planetary health. And this is a required growth mindset, embrace the change, the eager to reskilling, upskilling, relearn, re-educate, all these things. And then after we passing the fear zone, we're going to be a learning zone again, and we're comfortable for the next many years of having planetary health in many aspects. And I tend to do that, we have to be very clinical in what we're doing. We have to be very objective. We say, or we all know that in God we trust, the rest need data. And I think at this moment of time, the great work for all of you, we have a really solid, sufficient data to convince many stakeholders, in particular on my side, clinicians and scientists, they must embrace the change, taking into account the planetary health in part of their daily living, start with the personal living first. Like Dato Zaini, I think I have to plant many trees per week now, traveling, all of us. So I think it requires motivation, it requires discussion, it requires an openness, transparent, comprehension, and eventually, again, collaboration. In this era, I think we all know as academic before, whoever still academic, whether we publish or we perish. I think we should collaborate or we crumble. I think collaboration is the key with many stakeholders involved in the planetary health so that everybody not leaving behind the concept of planetary health in their daily life. Thank you.
Thank you very much, Professor.
I think in order to have more actionable policy in place, ministries, universities in particular, they have to understand and be able to act accordingly. Yeah, it is it's very difficult. For the past 13 years in government, probably I've involved with more than 30 government big policies. And I realized one thing. I'm going to retire about 300 days from now. 300 days, yeah? Tanti Jamila and me keep on counting. And the lesson learned, we don't want to spend too much time on debating what to do. We want to spend 80% of the time on the implementation, the execution, and in developmental way, in development approach. It means that we keep on improving from time to time. In the past, in many parts of the world, we were discussing about what to do, and we spend 90% of the time. And we have very little time left to implement. By the time you agreed everything, you have only 3 months for that particular session or for that particular period of your tenureships. So that's what we want to do. We would like to spend 90% of our time and effort on doing it. So I tell you what we plan to do on planetary health. One is development approach. We try to get people to be involved first. Whoever ready, go, we support. Yeah, and at the same time, we also try to encourage others to do it. I'm very sure that planetary health is very strong in medical fraternity at the moment, and in engineering fraternity, yes. Now we are talking about energy transition. This is in engineering field. Last year, there was a lecture. Every year, Board of Engineers in Malaysia, they have inaugural lecture. So I gave inaugural lecture for last year, and the topic for that year was sustainable engineering fraternity, something like that. I forgot to be exact. So I think in all aspects of engineering fraternity at the moment, planetary health or climate related is very, very, very important. And we would like to go to, say, for example, in other disciplines as well. On top of medicine, we are also thinking of areas like transportation. Yeah, this is a big thing. Resource development in the country. You know that Malaysia is very rich on rare earth. Probably we are second in the world, rare earth resources in the world at the moment. So the future of, say for example, EV is depending on rare earth. So Malaysia is one of the countries where you can get rare earth very easily and very cheap. So, and then we have to think, develop planetary health for mining industry. This is a big thing. And this was mining area where we are now located. So we try to encourage those who are ready to go first, and we give them a lot of incentive. And in terms of medical fraternity, say for example, I'm texting few professors, vice chancellors of university, what are the plans and whatnot. So probably they're too busy early in the morning. They are not telling me what they have done. But I am very sure that anything to do with climate change, environmental, planetary health is something that everyone must participate And this is what we try to do as well.
Thank you very much, Dr. Zaini. The issue of the limitations of traditional methods of teaching in tertiary education institutions, that has been exposed, and it's important for us to be more innovative in terms of how we address planetary health as part of the curriculum, etc. I'm wondering if there are any trends in terms of education in planetary health that perhaps we in tertiary level institutions can actually adopt. And more so, are there any successful examples, to really lead and that we can perhaps follow? So I also wonder as well, because I know that time is running out, the whole issue of research. It's an area that we need more research in terms of how to really ensure that the students can really get, the benefits that we really would like them to get. So I'd like to throw out those issues, the whole issue of, our comfort zone, how to get out of it, new trends in teaching, tertiary level education, and research. So I open that to the panelists.
I can speak a bit about that. One of the projects that we are working on at the Planetary Health Alliance is to really understand what people teach when they say they teach planetary health. And to this end, we started collecting planetary health syllabi globally, reaching out to educators and ask them to contribute for the dual purpose of understanding the instructional design they use and also kind of mapping the syllabi and the topics and learning objectives to the planetary health education framework. But at the same time, we want to share those syllabi with other educators as a way to support them and inspire them. And since we started working on this, I would say like 4 or 5 months ago, while reaching to the people to ask them for their syllabus, the response I would get, at least it happens already twice, was, well, we are working on the same thing. And I know in Canada, you are also in the initial stages of building the repository of planetary health curricula. At the same time, in Barcelona, at the University of Pompeu Fabra, I was in contact with the associate professor who is doing this as a part of the Erasmus project. So the interest is there, and I talked recently with a professor from Japan who has a PhD student working on this. So in situations like this, I think what works best is to connect and kind of join our efforts instead of, to be more effective, but also shows that this is something of interest and it's a very important topic globally. So I would just like to invite someone in the audience who also has this interest to please join us in this and feel free to reach out and join this effort of kind of really mapping the instructional designs of planetary health courses globally. Thank you.
Thank you very much, Jelena. You raised the issue of the audience, and I would like to invite members or the delegates present, if you want to join the discussion. There are microphones, standing microphones. You can please ask your questions, or you can raise any issues that you would like to. Oh, I see there's someone there. Young lady, yes, please, yes. Oh, you're not, okay, sorry, I thought that you were asking a question. Yes. Yes, Carlos, yes, please. No. We can't hear, yes.
Hello?
Yes.
Oh, there you go, thanks. Thanks for this panel. I'm Carlos Firo and I work with the Planetary Health Alliance. I'm sorry if I'm hugging the questions here. I wanted to jump back to Jelena's point on values, and we can agree that the science is important. We can agree that skills are important. We can agree that learning in spaces like universities about the knowledge that we've created is important. But I think from Nicole's Redverse talk yesterday, we also know that we can't just keep speaking to the brain. We need to speak to the heart as well. We rarely think about universities as a space in which we talk about values and we talk about the things that drives us beyond the science. So I wanted to ask the panel your thoughts on that. How do we go about moving from universities that are good at teaching the science, good at teaching knowledge, good at teaching the skills, to ones that are more transformative and talk about values and to people's hearts? Thank you.
Please. Thank you,
That's
Carlos.
such a great question, Carlos. And it was something we were struggling with. So as part of this last project that I did for Health Canada and the Association of Faculties of Medicine of Canada, I actually had to produce KPIs. And so one of the KPIs we ended up choosing involves the Planetary Health Pledge. So some years ago, I was part of the group that put together a suggested Hippocratic Oath for the Anthropocene that we published in the Lancet. And it starts, I solemnly pledge to dedicate my life to the service of humanity and the natural systems upon which it depends. And every time I say that, I get tears in my eyes. And I have taken many different disciplines through that pledge. And so we decided to involve the universities and also at the national level in creating a yearly national moment to have what we're calling a Planetary Health Pledge and Progress Party. And so the idea is to have, as part of a sort of group project this year, to define a national moment and then every year provide an opportunity and have it not only be an opportunity for us to affirm our commitment, but also to come together in community and then celebrate the progress that we've made that year. Because what we know is that when you win things and celebrate it, that attracts more resources, brings hope to make sure that we're really creating that cycle of action. And so that's what we've done. And one of our KPIs is the number of deans spotted dancing at our Planetary Health Pledge Progress.
Thank you very much. I'm seeing that there were a couple questions that came in online. One is, there's someone? Oh, a lady. Yes. I don't see the. Oh, there's a lady there. Okay. Okay. All right. While she comes forward, I'm seeing that someone is delighted, Dr. Zaini, for your support and action for planetary health. What are the key strategies to ensure that these initiatives and momentum sustain beyond your tenure? Second. Yes.
Curriculum development is the domain of Senate of Universities. I have to say that we don't want to interfere into Senate matters, but we will encourage a lot of discussion to ensure that planetary health is given enough attention and a lot more people interested to implement and to integrate in their syllabus, in their curriculum. But if you want to start a program called Masters in Planetary Health, that's doable, that's no issue. The issue is how can we integrate planetary health in the curriculum of medical degree, say for example. That is an issue, how the integration can take place. So I give you an example just now. So we talk about the framework where all subjects related to what you teach, you have a climate impact of it, a planetary impact on it. Say for example, a kind of treatment that you use for your patients, or a journey that we take, or whatever. So that is to infuse planetary health framework and thinking into the existing syllabus. I think this is more meaningful, rather than we start a new program called Masters in Planetary Health. That can be done, that's easy. That's what I have done, and that's what I have mentioned earlier when I started with Masters in Public Health Engineering, and then became environmental engineering and became the same subject, yeah, with some addition to it, became a Masters in Sustainability. That can be done very easy. The question is whether we get students or not to enroll. That's the issue. So there I summarized: one, develop a program, new programs altogether. Second, how can we inculcate planetary health framework, thinking, and practices in the existing curriculum? So that is to be discussed thoroughly.
Okay, thank you. We have run out of time, but okay, yes. Please.
I just wanted to
Jelena.
share an example of a success story that I learned about recently. The Medical School of Brown University is just implementing now, as we speak, they have approval to implement Planetary Health in all 4 years of medical education. And the way they're doing it, they were thinking about what is the best approach, and they decided to do longitudinal integration using the example of ethics and justice revision. That was the last revision done several years ago, and they were just thinking, well, if that worked for ethics, justice, and diversity, which they don't have as a separate course, but it's kind of integrated in each of the courses that medical students at Brown take, why not use the same approach for planetary health? And they are in the process now of consultations with all the faculty members teaching. So one by one, they set up individual meetings and they go through the syllabi and they agree on the best way to do that.
Okay, there's a
Going back
question.
to the question, I want to answer one question.
Okay, there's a question that Dr. Zaini wants to.
Can you go back
ask.
to the question?
There was the online questions were.
Yeah, I want to
shown
answer
before.
that question.
Okay, I'm not sure if the.
Who is in charge of that question, please?
Yes.
Yeah, I want to see that. Someone asking, this one, there is more, yeah. It's not this one, the previous one. Previous question. Okay, tokenistic than meaningful. This is very interesting. I don't know how to answer that question, but I give you an example. Probably I was one of the pioneer in Malaysia to introduce ecological microbial in engineering subjects using DNA and whatnot. And we are engineers. We hate biology. Okay? Generally, engineers hate biology. Therefore, they forget about it. When I did my PhD, I started using DNA in my labs. And my colleagues at that time, Professor Tom Curtis, is a microbiologist, but I was working with another professor, which is purely engineering and modeling. And I started using that, and he said that, Zaini, I'm not an expert in this. If you do this, it's your own risk. Okay? Your final chapter is you have to work with Tom. So, and when I came back, all my PhD students, 100% working on microbial ecology. Yeah? So, that is an example whereby a professor can play an important role. This is academics, it's academic freedom. You don't want to restrict the movement of professors, what they have to think, what they have to do research. And it's up to the professor to expand the boundary of knowledge into their existing body of knowledge. So the question asked should be to individual professors. How can you put planetary health in urology, in public health, in blah, blah, blah. So, and let them ask, let them answer the question. So I give you an example, and you have to justify when you want to integrate something to your subjects. So my justification was very simple at that time, because you want to go to the minute level. The subject I was working was, at that time, was on membrane, nanotechnology. So we couple nanotechnology and microbiology at that time, or biotechnology. So it became very advanced in that sphere. So this is a knowledge venture that someone must lead. And if you want to bring planetary health to another level in Malaysia, say for example, professors must there to do it themselves. Yeah, and then the rest can follow suit. Because you have 20 PhD students working with you, you have, I don't know, 100 master students working with you. At the end of the day, it became a trendy thing in the country.
Okay, as we end, I would like to ask the panelists to give in 30 seconds any final reflections on this morning's discussion. Professor Affendi first.
Maybe I can start first. Share a little bit, Professor Simeon, that our future-ready medical school we're embedding planetary health in medicine, sustainability medicine in our undergraduate medical curriculum that we're going to start pretty soon. So my final statement, 30 seconds, I think, how do I phrase? We must visualize a success of bringing planetary health in higher education. That's final statement. Thank you so much.
Yeah, thank you. Dr. Courtney?
What I realized when I was putting this curriculum plan together is that incorporating planetary health into medical education is indivisible from creating sustainable healthcare, because we don't just get lectures, we work in hospitals. And therefore, this is part of transforming the world into the world we need for healthy people on a healthy planet. And so as you move forward, don't be afraid to be like, actually, no, this is about systems transformation as well as educational transformation. And building a little bit on what Carlos was saying about the need for data to speak to the head and emotion to speak to the heart, really also thinking about what tools do you need to give people for their hands so that they can do that work of transformation to build the world we need. Thank you.
Yes, thank you. Dr. Jelena?
In my final remarks, I would just like to respond to one of the questions that I saw here on the screen earlier. The question was, how do we measure success of planetary health education? And I think if we remind ourselves why we believe it's important, and that is, planetary health education is important for us to teach us how to achieve the just great transition in the way we live on this planet, how to change our patterns of production, consumption, the role we see in nature and within nature, and the way we plan and raise our families. So that is how we're going to measure, at the end, the success of planetary health education. And I believe I'm an optimist, and I will believe that we are able to learn and that we are able to achieve the just global transition.
Thank you. Dr. Zaini, final.
Transformation occurs when 70% of our resources and time is dedicated to action. So let's do it.
I'd like to please join me in thanking the panelists for their excellent discussion this morning.
Thank you very much.